Today, we know Parkland as a modern, bustling health system. But long before Parkland Hospital and our network of health centers became what they are today, it all started with the support of our community. In April 1893, Dallas citizens voted to approve $40,000 in bonds to build a hospital at the intersection of Maple and Oaklawn Avenues. Taking its name from the wooded parkland it sat on, Parkland opened on May 19, 1894 in a group of wood-frame buildings. Over the next several decades, Parkland's wooden buildings would be replaced with brick structures. You may recognize these buildings as the campus has been refurbished into the headquarters for Crow Holdings. In fact, the main building still bears Parkland's name. A major milestone occurred in 1943 when Parkland established an affiliation with the new Southwestern Medical School. This relationship continues to this day, with Parkland serving as the primary teaching hospital for the University of Texas Southwestern Medical School. In 1949, city and county officials forged a $7.5 million agreement to build a replacement hospital as a war memorial. The hospital would move from its home at the corner of Maple and Oaklawn to Harry Hines Boulevard, and on September 25, 1954, the first patients were transferred from the old Parkland to the new Parkland Memorial Hospital. In its first year, the new Parkland admitted 14,719 patients, delivered more than 4,000 babies, and saw 57,256 emergency patients. A lot of history and groundbreaking care took place in this facility, but perhaps Parkland's most famous moment came on November 22, 1963, when President John Fitzgerald Kennedy was taken into Trauma Room 1 at Parkland after being shot in Dealey Plaza in downtown Dallas. Many people don't know that in addition to treating the president, Parkland would also care for his assassin, Lee Harvey Oswald, when he was shot just 2 days later. An anecdote that truly illustrates Parkland's dedication to caring for all those who are in need. In a letter to the hospital, Texas Governor John Connally wrote, "Words cannot adequately express my personal appreciation for the care, treatment, and supreme thoughtfulness my family and I have received from all of you. These have been trying days for everyone connected to this great hospital, but you have risen to the occasion with a dedication to duty which merits the highest confidence and praise. Parkland has proved again that it is one of the finest institutions of its kind in the world. To this day, if a United States president visits North Texas, Parkland is the designated hospital if the need arises." The largest expansion of Parkland Memorial Hospital began in 1981 with the construction of the 10-floor, 204-bed North Tower, a 7-floor outpatient clinic, and a 5-story support building. Costing $80 million, the project increased the total number of beds from 750 to 940, the number of bassinets from 159 to 187, and the number of outpatient clinic rooms from 132 to 215. Another major moment in Parkland history came in 1987 with the establishment of the Community-Oriented Primary Care Program. This network of community-based clinics would become a national model for how to provide primary care to underserved populations. Now known as Population Health, it includes more than a dozen primary care and women's health centers, as well as specialty clinics, homeless outreach or homes vans, health care at the Dallas County Jail, school-based youth and family centers, the Comprehensive Breast Center, and much more. The main campus would not see another building until 2007, when Parkland opened the Simmons Ambulatory Surgery Center at the corner of Harry Hines and Medical District Drive. This outpatient surgery center helped relieve the backlog of surgeries in Parkland's operating rooms, which are often taken up with life-saving trauma and burn surgeries. Fast forward to 2008, and Parkland has outlasted its more than 50-year-old facility. Dallas County voters overwhelmingly approved more than $700 million in bonds to build a new Parkland Hospital on the other side of Harry Hines Boulevard. The new hospital has 870 beds, encompasses more than 1 million square feet, and costs more than $1.3 billion to construct. It opened on August 20th, 2015, and all Parkland inpatients were moved across the Mike A. Meyer Sky Bridge during a highly coordinated 2-day move. The campus would expand again less than 2 years later with the addition of the Ron J. Anderson MD Clinic building, which houses many of Parkland's outpatient specialty clinics. Today, Parkland is one of the premier public health systems in the country, earning awards and accolades for the quality care and innovation that happens here every day. But despite the astronomical advances in technology and medicine, our primary purpose remains the same as it was in 1894: to care for the members of our community who need it most.